Natural versus induced labor. Is there any difference? Does it even matter? I'll be talking to you about it. So natural labor is where labor starts on its own. Baby decides it's time, your body releases hormones, and then contractions start. Induced labor is where we actively do things to bring about contractions and labor. Now, we do this for a variety of reasons. It could be that the pregnancy has gone way beyond its due date. It could be that we have medical reasons why it is better for the pregnancy to be discontinued to reduce risk to both you and your baby. It could also be that your waters have gone and there have been no contractions starting. Induction of labor can be divided into 3 stages. The first stage of the induction of labor is trying to get the cervix soft, shorter, and open to about 2 to 3 centimeters, what we call cervical ripening. There are different methods of doing this. We could do what we call a membrane sweep, which is just like a pelvic examination. We could also use some tablets or pessaries which contain prostaglandin, and we could also use balloons to try and open up the cervix. The second stage of an induction process is the breaking of the waters, and the third stage is commencing the hormone drip or oxytocin. Now remember that oxytocin is not a stranger to your body. In natural labor, your body actually produces oxytocin. So the main difference between natural and induced labor is that natural labor is usually a more gradual process. However, induced labor is more intense and requires more monitoring of both you and your baby. In addition, a lot of people who have gone through both natural labor and induced labor have said that the pain is more intense with induced labor, with most of them requiring more effective pain relief like an epidural. Whichever method of labor you go through, whether natural or induced labor, the aim is still the same at the end of the day, to have a safe delivery. Follow me for more tips.